Breast cancer is a type of cancer that forms in the cells of the breast. It can occur in both men and women, although it's far more common in women. Breast cancer usually starts in the ducts or lobules of the breast, but can also occur in other parts of the breast tissue. Here's an overview of breast cancer. Types of breast cancer. Ductal carcinoma in situ, DCIS. This is a non-invasive form of breast cancer, where abnormal cells are found in the lining of a breast duct, but have not spread outside the duct. Invasive ductal carcinoma, IDC. This is the most common type of breast cancer. It starts in the milk ducts of the breast and then invades nearby tissue in the breast. Invasive lobular carcinoma, ILC. This type starts in the lobules of the breast and can spread to nearby tissue. Triple-negative breast cancer. This type lacks estrogen, progesterone, and HER2 receptors, making it more challenging to treat with hormone therapy or drugs targeting these receptors. HER2-positive breast cancer. This type overexpresses a protein called HER2, which can promote the growth of cancer cells. Targeted therapies are available to treat HER2-positive breast cancer. Risk factors. Gender. Women are at a much higher risk of breast cancer than men. Age. The risk increases with age, with the majority of cases occurring in women over 50. Family history. Having close relatives with breast cancer increases the risk. Genetic mutations. Inherited mutations in genes such as BRCA1 and BRCA2 significantly increase the risk of breast cancer. Personal history. Previous breast cancer or certain non-cancerous breast conditions can increase the risk. Hormonal factors. Early menstruation, late menopause, never giving birth or giving birth at an older age, and hormone replacement therapy can increase the risk. Symptoms. Lump or thickening in the breast or underarm area. Changes in breast size or shape. Changes in the appearance or texture of the breast skin. Nipple changes such as inversion, discharge, or scaling. Breast pain or discomfort, though not usually a common symptom of breast cancer. Diagnosis and treatment. Diagnosis typically involves a combination of imaging tests, mammograms, ultrasounds, MRIs, and tissue sampling, biopsy, to confirm the presence of cancer. Treatment options depend on the type and stage of breast cancer, but may include surgery, radiation therapy, chemotherapy, hormone therapy, targeted therapy, or a combination of these. Early detection through regular screening and awareness of potential symptoms can significantly improve the prognosis of breast cancer. Treatment outcomes vary widely depending on factors such as the stage of cancer at diagnosis, the specific characteristics of the tumor, and individual health factors. The exact causes of breast cancer are not fully understood, as it's a complex disease with multiple factors at play. However, researchers have identified several factors that may increase the risk of developing breast cancer. Here are some of the main causes and risk factors associated with breast cancer. Genetic factors. Inherited genetic mutations. Mutations in certain genes, such as BRCA1 and BRCA2, significantly increase the risk of breast cancer. However, only a small percentage of breast cancers, around 5 to 10%, are due to inherited genetic mutations. Hormonal factors. Estrogen exposure. Prolonged exposure to estrogen over a woman's lifetime is associated with an increased risk of breast cancer. Factors that increase estrogen exposure include starting menstruation at an early age, experiencing menopause at a later age, never having children, and using hormone replacement therapy for menopausal symptoms. Hormone-related conditions. Certain hormone-related conditions, such as dense breast tissue and benign breast conditions like atypical hyperplasia, can increase the risk of breast cancer. Lifestyle and environmental factors. Alcohol consumption. Regular alcohol consumption, even in moderate amounts, has been linked to an increased risk of breast cancer. Obesity and physical inactivity. Being overweight or obese, especially after menopause and leading a sedentary lifestyle, are associated with a higher risk of breast cancer. Diet. A diet high in saturated fats and low in fruits, vegetables, and fiber may contribute to an increased risk of breast cancer, although the exact role of diet in breast cancer development is still being studied. Environmental exposures. Exposure to certain environmental pollutants, chemicals, and radiation may increase the risk of breast cancer, although the extent of their contribution is not fully understood. Reproductive and menstrual history. Age at first childbirth. Having the first full-term pregnancy at a later age or never giving birth to children is associated with an increased risk of breast cancer. Menstrual history, starting menstruation at an early age before age 12 and experiencing menopause at a later age after age 55 are both risk factors for breast cancer. Personal and family history. Personal history. Women who have previously been diagnosed with breast cancer have an increased risk of developing a new primary breast cancer in the same or opposite breast. Family history. Having a first-degree relative, parent, sibling, or child with breast cancer increases an individual's risk of developing the disease, particularly if the relative was diagnosed at a young age or if multiple relatives are affected. It's important to note that having one or more of these risk factors does not mean a person will definitely develop breast cancer. Many individuals diagnosed with breast cancer do not have a family history of the disease or any other known risk factors. Regular screening, early detection, and lifestyle modifications can help reduce the risk of breast cancer and improve outcomes.